We are back on the pulse here on Joy News. My name is Elton Brobe. Now let's settle and deal with a very important matter that has gripped the nation since the results came out yesterday. Now, the latest demographic survey on health reveals males and females between the ages of 15 and 24 are keeping multiple sexual partners and further engaging in unprotected sex. The Statistical Service that undertook the survey says the outcome is worrying, as it could lead to the spread of HIV and AIDS. The Director General of the Ghana AIDS Commission, Dr. Steve Chairman Atuahene, is our guest today. But before we do that, my colleague Kofi Ajay joins me in studio with more from the survey. Kofi, I guess you have more to tell me this afternoon.
Well, staggering figures.
Well, let's get it on
the start screen. So we are starting with a percentage of men and women who are 2 or more partners. So there are actually some people in Ghana that have 2 or more partners. And we are looking at this data between male and female. So if you look at the age range, it begins to tell you an interesting story. So if you look at those within the ages of 15 to 24 years, about 9.9%, almost 10% of this age bracket say they have 2 or more, sexual partners. You ask yourself, people between the ages of 15 and 24 confirming that they have 2 or more, partners. And if you begin to raise the age bracket,
I was actually hoping that this survey outcome would tell me, for example, the percentage of the age bracket, maybe let's say from 15 to 17, the percentage of people within that bracket, and whether or not between the 15 and the 17, more of them are having multiple partners. And then from 18 to 24, because from 18 you are considered an adult, so you can afford to take certain decisions for yourself.
They actually did that.
Right. Let's go on.
Disaggregation. And one thing that begins to emerge is that once you begin to move from 24 years or from 15 to 24 years, the number or the share of the population begins to increase. So if you look at those within the ages of 25 to 29, close to 24%, of men confirm that they actually have, 2 or more sexual partners. 23.6 against 3.3% of females who actually engage in this survey also saying this. So you can see the sharp contrast between the response that we got from males versus that of female. But there were other interesting, revelations that came out as a result of this survey. We realized that if you compare male and female, you realize that even with this age bracket of 15 to 24 years, one, they accepted that they have more than one, sexual partner, 2 or more sexual partners, and they also acknowledged or accepted that they have about, 80% on the female side and about 70% on the male side, accepted that they have, unprotected sex in their last sex before the survey was conducted. So they were asked a very simple question. Did you use condoms during your last sex? And if you look at the male side, 7 out of 10 of the people sampled actually confirmed that they had sex without condoms. If you look at the female side, it's about 80%. And then we also realized that if you look at the level of education, on the side of men, the higher the level of education, the higher the probability of they deciding to cheat on their spouses. And it's different from that of women. The higher their level of education, the lower the probability of they cheating.
Is it a case that for men, the higher the level of education, they get good jobs, income is good, they are driving nice vehicles, they're living comfortable life, and therefore they begin to explore. Their tastes become big, and they want to, go down with anything they come across with.
It could be one of the factors actually driving this, because if you look at those who are even not married, never married, but were asked a very simple question if they have unprotected sex, and if you look at the men, about 5 out of 10 of those samples said, yes, I am not married, one, I keep multiple partners, 2, and then I also have unprotected sex. And this is where the issue of the spread of HIV comes in,
right,
where you have majority of the people who engage in this survey or who participate in this survey. We are talking about people aged between the ages of 15, and 45 years. You know, you have about 5 out of 10 males saying that, I mean, I don't have a wife, but I also have multiple partners. I have 1 or 2 or more girlfriends, and I also had unprotected sex the last time that I did have sex. If you go to the women's side, it's almost 4 out of 10. And so you could see that this is one of the key indicators, you know, as far as we are talking about the spread of HIV is in Ghana. So those were some of the staggering statistics or interesting data that we were able to glean from the 2022 Ghana Demographic and Health Survey conducted by the Ghana Statistical Service, Elton.
There is an issue that has generated some controversy about cheating husbands and wives. And the suggestion is that the figures looks a bit, you know, flowery, if you like.
Yeah, exactly. When we share the data on social media, the reaction is that, wow, 2 out of 10. We believe that some say it is 99.9999%. I saw one comment that one person said he doesn't believe that it's 2 out of 10 men in Ghana, married men in Ghana, that cheat. But he believes that even 12 out of 10 men in Ghana cheat when they marry. But if you begin to look at the age range, 15 to 45 years, there are also concerns that, I mean, there's what we call the sugar daddy system, where people who are maybe rich and then are between the ages of 50 and above, they also are married, but they engage in extramarital affairs. They were not included in this survey. Some say then if we should include this age bracket, they believe that the 2 out of 10 men who said they are married but they cheat could go higher. If you look at it from the side of the women, the data or the statistic there is a bit relatively lower than what we saw for the men. So we can say that as a result of the outcome of the demographic and health survey, we can confidently say that 2 out of every 10 married men you select between the ages of 15 and 49 in Ghana actually cheat. So therefore, we can say that when it comes to the women or the ladies, they respect the sanctity of marriage. Well, according to the data, I mean, their figure is relatively lesser than that of men. But one thing we also know is that if you look at women and the level of education, you map it to the probability of they having sex or, you know, sexual intercourse with people that they are not married to, they begin to lower the percentage as and when they begin to upgrade in terms of education. But with men, they do it more when they become educated. Kofi, thank you very much. And of course, we have the Director General of the Ghana AIDS Commission to help us digest the survey outcome and then to look at the way forward. What is clear is that more people are having sex. And the danger here is that you have more people having sex with multiple partners. And more instructively, more people are having sex without using protection. They are not using condom. Ghana is currently on the HIV fast-track countries because of the new infection. The Director General of the Ghana AIDS Commission, Dr. Steve Atuahene, says the criminalization of people engaging in same-sex marriage and other activities is leading to the spread of the virus. And this afternoon, I'm privileged to say that he joins me here in the studio. Dr. Atuahene, you're welcome.
Thank you.
So I saw you yesterday when the Ghana Statistical Service presented the outcome of their survey, and you had some few words to say. Now, first, let's deal with the matter when you said that Ghana is on the HIV and AIDS fast track. What does that mean?
Right. The UNAIDS and WHO in 2017 identified countries with highest level of new infections. And those countries were put together for an initiative called Global Prevention Coalition Initiative.
Right.
Because prevention is key to reducing new infections. And so Ghana was then one of the 28 countries that had highest burden of HIV new infections. Now the number of the countries is gone up to 36, I think. And so Ghana is one of the countries in the whole world with the highest burden of new infections.
And that should be very worrying.
Yes.
But it is worrying.
Yes, it is worrying. And the data that is being shared now from the Ghana Statistical Service clearly show that indeed that situation is true, and we should take the necessary steps to address the high levels of new infections by addressing our risky behaviors. Now, in Ghana, we have the sexual intercourse account for 80% of HIV transmission in the country. Mm-hmm. And so for us, we need to understand that sexual activity is a major factor to the number of new infections that we are seeing in the country, or major factor to HIV transmission in the country. And so why is it a factor? It's a factor because you have high numbers of people, old and young, having sex, and they are into multiple concurrent partnerships. They are having casual sex, and they are not protecting themselves.
Right.
So that then becomes a problem, because it means that there is high probability that when one doesn't protect him or herself during casual sex or in a multiple sexual partnership relationship, then we have the likelihood of HIV transmission occurring when one of the sexual partners
is a carrier. But so doctor, what do you blame this on? Is it the case that we have taken our leg off the paddle in terms of education and awareness creation, or people are aware, but they simply don't want to use protection when engaging in sexual intercourse?
Okay, so when you look at the DHS report, the report we are discussing today, it shows that Ghana has almost universal awareness rate, which means more than almost 100% of Ghanaians know that HIV and AIDS exists and they are in this country. Mm-hmm. Okay. And therefore, if it is just about the awareness, then everybody is aware. Mm-hmm. Everybody also knows that you can get HIV through unprotected sex. And so you expect that with this knowledge, mm-hmm. people will do what? Take the necessary steps to prevent HIV infection. But that is not happening. It's not happening because every person, has a low perception of personal risk to HIV. You get the point?
Right, I do.
So the level of perception of personal risk actually determines whether a person will take the needed steps to protect him or herself, or will just open up thinking that nothing would happen.
But of interest to me really is the fact that some time back we had reduced the prevalence rate in Ghana. So the expectation that going for 2024 and going beyond, HIV shouldn't be an issue at the front burner. Why? I mean, we managed to reduce it, and now we appear to be back on where you described as unacceptable. So what has happened between when we managed to reduce the prevalence rate and now?
Well, prevalence has been on a declining trajectory for a very long period of time. And so we know that the factors that lead to increasing levels of HIV infection in the country are still persisting. Now, you are driving, your question is actually asking whether we are doing enough education?
Exactly.
Or not. Yes. When you see the data.
Because I believe we have a target to basically reduce it to a level where it wouldn't be an issue.
Exactly. When you look at the data, you can see that some of the indicators that were measured, we had better results in the year 2003 than every other year up to now. I mean, every other survey year up to now. Okay. What that means is that in those days, from the 1998 up to 2000 and let's say 2007-8, we had intensive media campaigns on HIV prevention throughout the country. From then, we slipped back because we didn't have enough money. And we haven't had the kind of money we used to have, you know.
Because the Global Funding withdrew their
the Global
part of their
Fund,
support.
No, the Global Fund has never withdrawn funding to Ghana. They continue to give us funding, but their funding goes into treatment, prevention of mother-to-child transmission, some aspect of management of the health sector program, as well as key affected population prevention interventions. We do not have money for the general population. The money that we use for the general population is very, very small. And so we need money to do the kind of campaigns we used to.
And where should the money come from? From the government or from international development partners? I understand that when Ghana attained the lower middle status, it affected, you know, support from some of these organizations.
Yes, that is true. As the country progresses in its economic status, donors, you know, withdraw funding, or they try to arrange the funding in a way that the country would also take, you know, part of the burden. It's burden share arrangement. And so within the burden share arrangement, Ghana is expected to take up about 60% of the cost of the national program.
Right.
And Ghana is not able to do that. It's able to do part of it, but not all of it. And so the money that should go into these activities is unavailable.
And that questions the seriousness we are attaching to this. But let's now focus a bit on the outcome of the survey. Now, I asked my colleague Kofi Ajay earlier that I wanted to see the percentage of the age bracket between 15 years and an example 17 years. It looks like they didn't give us those specifics. But 15 years is too young an age for anybody to be engaged in sexual activity. What really is happening?
You see, I'll tell you something. We were in 2007 doing modeling to see the modes of transmission of HIV in the country. And one of the indicators, the data that we required for the modeling is coital frequency. That is the rate of coital frequency in the country. As Ghanaians, how often do we have sex? DHS used to measure that indicator, I think around, they used to do it and it stopped along they took it out at some point. And so only 1998 DHS gave us that data for that indicator. And that indicator showed that coital frequency was about 1 in a month.
Break it down for me.
The number of times a person, you know, has sex in a year. So when you, according to the data, if my memory serves me right, it was about almost once in a month. And so the white people who were working with on this modeling said, what? Ghanaians don't have sex.
Yeah.
And when you look at data from 1998, 2003, all the way down to this point, you see that first sexual debut, that is when young people first have sex, the first time sex among the young people below age 18 was almost negligible in the early years. But from 2003, we have seen progression, upward progression. What it means is that young people are becoming more and more liberated when it comes to sex. And it is so now because of the internet.
Right.
They have access to a lot of information. And you can arrange to have sex without talking to anybody by just being on the internet or on phone. And parents will not know. Nobody will know. And of course, our educational curriculum also keeps changing. And so some of the things that were in there that ensures the kind of value that would, discourage young people from engaging in sex is all also being something else. I wouldn't want to use certain words. And so as a country, we are at a stage where we need to take our education system seriously as to how we use education to address the basic problems of the country. And one is sexual and reproductive health, especially among adolescents.
Because they are getting the education from somewhere else.
Exactly.
And so therefore, you want to step up what constitutes proper education.
Yes.
Sexual education.
Yes.
So these figures and the fact that many young people are engaging in sexual activities, they are not protecting themselves, and they are even keeping multiple partners.
Yes.
What is the Ghana AIDS Commission doing with this?
Okay. So we have the National Strategic Plan prioritizes young people, especially adolescents.
Do you know the percentage of young people that are HIV positive?
Oh, yes. We know. We have that data, which I can show you.
Sure.
We have...
Right, so we are talking to the Director General of the Ghana AIDS Commission, and he's going to share with us figures that will speak to you and tell you the percentage of young people engaging in sexual activity, the percentage of young people HIV positive in the country. And if you are listening and you have any concern, you can drop your comments on our social media handles on Facebook, on X, and of course on our YouTube channel. And then I'll put that question before the Director General of Ghana AIDS Commission. This is a very important subject because when you have young people between the ages of 15 and 24 engaging in active, sexual intercourse, some keeping multiple partners and not protecting themselves in the process. This is the outcome of a demographic survey undertaken by the Ghana Statistical Service, and that's the reason why we have the Director General of the Ghana AIDS Commission in the studio to throw more light on it and to find out what they are using the outcome to do in terms of age education and creating more awareness about HIV and AIDS. And that is what Dr. Steve Atuahene is trying to walk us through. Doctor?
Yes, so the number of young people between the ages of 15 and 24, as at the end of 2022, were 40,500.
Wow, 40,500 people infected with HIV.
Young people. Age 15 to 24. Live with HIV in the...
Over 40,000.
Yes.
This is what we can even account for, isn't it?
Yes.
Because the last time you updated us on the status, you said some people had come for the test, but they didn't come to get a result. And they were probably walking around not knowing their HIV status.
Yes.
So between 15 and 24, over 40,000 people are living with HIV.
Yeah. Yeah, and every year, the number of people, the contribution of young people of the same age group to new infections is almost a third of the total new infections in the country.
That is the highest. A third, okay.
A third.
Right.
So if you have 15 to 24 contributing almost a third of new infections in the country, that is also very worrying because our objective is to have a HIV-free generation. And if these young people do not have HIV, if they do not have HIV, then we have the opportunity to break the HIV transmission in the country, because within that age group, there will be, so when those ahead of them are no more, there will be no HIV in the country. And so we need to take the issues about young people very serious.
Right.
And I mentioned that young people contribute about a third of new infections. But when you break it down by sex, it is even quite worrying, because
Tell us about
you see
it.
that 83% of new infections that occurred among these young people actually occurred among females. Females. And so, which clearly tells you that, you know, the young females are getting it not from their age mates, but from
Other people.
yes, older ages. And when you look at the DHS and multi-cluster indicated survey, you will see that the result shows that there is a high level of intergenerational sex.
In that.
That is, older men having sex
With younger people.
younger and adolescents.
And you think that is accounting for the 80% infection rate for females between the ages of 15 and 24?
Yeah, it's a major factor. It's a major factor.
What is the level of infection between, let's say, 24 years and 50 years?
24
years and 50 years.
And 50 years.
Yes.
In terms of what?
In terms of, you gave us a figure for between 15 and 24.
Yes. So
over 40,000 people are working,
yeah,
and they are HIV positive.
Yes.
And out of them, 80% are females.
Yes.
And I'm asking if you have the figures for between 24 and 50, because if we have people
so 25
who are gainfully employed and then they are keeping multiple partners, I mean, they probably may be the supplier of the virus.
Yes, that's exactly what the data says. HIV affects the most economically active population, so from 15 upwards. And therefore, if you put together, let's say, all the age groups from 25 and above, yes, that population is 289,700.
289,000. These are people between the age of 24 and above.
25 and above.
25 years and above.
Yes.
You have 250,000 of Ghanaians HIV positive.
Yeah. 289.
289,000.
Yes.
Of Ghanaians between 25 years and above, yes, HIV positive.
Even with HIV.
A percentage of that, male and female?
I need to break that down. I don't have that here with me now. But yes, you have, yeah, it should be here.
All right, so we are looking at the figures. These are very worrying figures. And if we know the effects of HIV on the human body and development, you appreciate the fact that we need to take a more serious approach to this matter. So, doctor just given us figures, over 40,000 between the age of 15 and 24, over 40,000 Ghanaians are HIV positive between 15 and 24. And out of this number, 80% of them are females. Now, from 25 years and above, almost 290,000 people are living with HIV. And I'm trying to find out from him a percentage of that for females and males. That is what he is trying to educate.
Yeah,
Doctor,
I don't have that.
You don't have it?
Yes, but overall, when you take the entire HIV population, which is about almost 355,000, the female population is 239,682, 92, which is almost, let's say, 240,000 females, as against 115,000 males. So it's about 2:1, right?
Right, 2:1.
Yeah.
Very, very interesting and very frightening figures that you have there. But this is what you can actually lay hands on.
Yeah.
What about those walking around? They don't know their status. People have come for the text. They didn't even come for the results. How many are we looking at? The last time you mentioned a figure of around 100,000.
Yes, 100,000 people are estimated to be living with HIV without knowing their test
results.
HIV status.
So such people, do you have a program to identify them and to offer them any support that they may require?
So the testing program seek to, first of all, identify these people. So anyone who walks into the health facility is offered HIV testing. It's not by force. So the person has to voluntarily accept to test. And so the healthcare worker will offer the test to the person. And if the person accepts, then he's tested. Those who are inpatient, they are also given the same offer or opportunity to know their HIV status. This is one way of, getting the cases. When somebody tests positive, we also would want to see if their partners or even children within that household might have HIV. It may not be, married couple. It may be just, sexual partners or people within one sexual network. And so it is offered to them, and they are counseled to make sure that, they accept to test. The other thing is that we have community-based programs where testing is offered. So they talk to people.
And the test is for free?
The test is for free. Now, self-testing has been added because many people complain that they are not too sure whether a third party will not have access to their test results. And for that reason, they may not want to test in health facilities. And so self-testing is made available. You can access through the internet. There is internet-based distribution and community-based distribution. So in most places, most communities in Ghana, it can easily be accessed. And then it gives you all the information you need to know to conduct the test, read and interpret the results, and the necessary steps you need to take after you have seen your test result, so that you can receive the appropriate service to either help you stay negative or access treatment.
Doctor, I'd like to thank you very much for coming through. And before you go, your final words as you speak to Ghanaians.
Yes. We are very particular about the sexual activities among Ghanaians. We are not saying people should not have sex. What we are saying is that we should be responsible with our sexual activities, because only one person can protect you from getting HIV, and that person is you. That responsibility is 100% in your own hands. And if you do not take responsibility for your own life, no one can do it for you. And one of the things you can do is, if you are not married, it's better you abstain from sex. If you cannot do that, then avoid having multiple partners. And if you have multiple partners, please reduce the number to just one person who doesn't have HIV. And of course, you must also not have HIV. Even if you have HIV, you can still live with somebody who doesn't have HIV, but you have to make sure that you are on antiretroviral treatment and you are virally suppressed, or your viral load is at undetectable level, and you maintain the undetectable viral load status all through your life. In that case, you will not transmit the virus to your partner. And if you cannot do any of these, always make sure you use condoms at all times.
Doctor, thank you very much for coming through, and wish you the very best as we step up the education on HIV. And folks, again, let me reiterate the points made by Dr. Steve Atuahene. The fact is, we have between the ages of 15 and 24, over 40,000 Ghanaians are living with HIV. And then between 25 and above, over almost 290,000 of our folks are living with HIV and AIDS. The people living with HIV and AIDS the population in Ghana is over 300,000. There are over 100,000 people who've gone to do the testing. They are yet to go and then get the results. So this is the grim picture we have for you this afternoon. Protect yourself, stay safe, and then use protection if you must. This is The Pulse. My name is Elton Brobe.